Hey guys, Dr. Savannah Torrez here from Chandler Physical Therapy. Today we're talking about hip pain and low back pain and muscle imbalances that can commonly present with these sort of presentations. When testing for hip strength, we want to be able to differentiate hip weakness from the front side of the hip and hip weakness from the back side of the hip, both of which can cause pelvic instability. So the first way that we want to test is we're actually looking to differentiate weakness in the front of the hip or weakness in the back of the hip. So in order to test the back side of the hip, okay, we are going to lift up right here and we are going to internally rotate here. And first you just want to make sure that they can hold this position. So go ahead and hold, okay? And if they're able to, then you're going to apply a little bit of resistance, so don't let me move you. And you're checking to see if they can hold that, okay? Now to check for the front side of the hip, we're actually going to externally rotate and then slightly bring it back right here. Again, you're looking to see if they can hold that position there. Okay, Jason does a good job of that. Don't let me move you. Hold, hold, hold. Okay, go ahead and relax. And so he was actually stronger in that specific position there.
So with that, Jason, what felt easier for you? Position one versus position two?
Which one felt easier?
Yeah.
The second one did.
The second one did. And Savannah, when you bring in position two, what is the patient using commonly with that?
For position two, they are using the TFL in the front side of the hip, and a lot of times people who are quad dominant, they tend to be stronger here and compensate with the front side of the hip. A lot of times they're not utilizing the back side of the hip or the glutes. They're often inhibited here, and so this results in some weakness right here, which can affect pelvic position and stability, which can contribute to hip and low back pain. If you find yourself weak in position one exercise that we actually like to do here in the clinic is called a sideline fire hydrant. Okay, Jason's actually going to demonstrate that here. We like to have you in sideline, bottom leg straight, top leg bent to a little less than 90 degrees, and he's actually going to lift that leg up for me to where he's parallel with the table, and then back down. Okay, do a couple more for us. Excellent. And so that'll help isolate the back side of the hip and focus a little bit more on glute strengthening. Yeah.
What compensations would you see?
Common compensations that we see are people actually rotate around and they involve the low back more because they're weak and they're unable to either lift the leg or they're just, it's too much of an exercise for them.
What would you cue them to do to prevent that?
I actually like to have people roll a bit more forward because it doesn't allow them to cheat and roll back so much. A lot of times people will start in this position, go ahead and lift up the leg, and then they'll roll back as a way to compensate and not isolate the glute.
And how many would you recommend?
Repetition wise, I like to start 2 rounds of 15. If you find that that's too much or that you start compensating, you can start at 2 rounds of 10. But that's a good place to start. As they get easier, you can always increase the reps.
Well, how else would you make it more difficult?
You can make it more difficult by adding some resistance to it. So I like to add an ankle weight and just wrap it around here. You can do more sets, you can do more reps, anything like that. Those are all good progressions.